morning. So if there's any problems in the future, it's their fault. And anything that goes right through the government's program. Like you said to the young doctors. That was a program in the 80s, you weren't around. The program that we announced funding for a couple of days ago is frankly with all you good folk in mind. This is a huge investment by us, but we've looked at the numbers long and hard over the last 6 to 9 months, and frankly this is the only way to make a difference. The country needs each and every one of you. There is this woeful undersupply of GPs across Australia. We've got to make sure that you have not just an appropriate number of university courses, but you've got an appropriate number of positions to do your internships within hospitals and to become the registrar position with GPs. Unless we actually join up with the dots with all of that, it doesn't work. So that's why we've decided for the first time to become the dominant funders of the entire Australian public hospital system. The first time becoming the exclusive funders of the non-hospital health services of Australia. Because for so long we've all had these two levels of government running in different directions. The feds, that's us, historically responsible for university places, never enough. And then the states, by and large, responsible for the training places for GPs and for others, specialists, in hospitals and out there in the community with GPs. The result, the two worlds never spoke to each other. Now, under our plan, they do, and we become the dominant and, in some cases, the exclusive funder of both. But that's all fine. That's what we do at the level of government. But it only works if you make it happen on the ground. And that's why your expertise, knowing what you're doing, being professional and competent at what you do, being sensitive to the disparate needs of the Australian community. Nicola and I were out at a practice at Isabella Plains here in Canberra yesterday. Anyone know where Isabella Plains is? Well done. You're from Canberra? I'm impressed you know where Isabella Plains is. I wasn't quite sure until I got there. I knew where it was. And I live here. But it's way down south in Canberra. But they're in that practice with, I think, Nicola, from memory, 13 GPs, 9 full-time equivalent. They had one person there who was under the, give me the acronym. The PGPPP. I've been trying to memorise that for 3 days. And so very quickly, PGPPP. And others, I think there were 3 there, who are under the GP training program as well. And I listened very carefully to what the local GPs had to say in that practice about where they could expand to. And if they can get a bit of help in expanding their physical premises down there, they can accommodate many, many more. Here in the ACT, we only have 3, is that right? Fully accredited and registered practices which are capable of doing this. Nationwide, can't just say we need many, many more, so that folks like you get the complete start that you need. A number of people have said, well, why, if you're going to expand all these places, don't we mandate you staying 20 years in Galagan Bay as a GP? Stop looking panicked.
I didn't announce that bit of the plan.
That's another questions we've got. Our view is that if we provide proper support for you to get your training out there in GP practices, right across the country, a big spread, metropolitan, regional, rural, country and city. If you spend a few years out there and you discover Mr. Right or Mrs. Right, and you decide to settle down there, well, frankly, that's going to be the best way in which you will have to be anchored in that community in the future. So that's one of the reasons why we've got some confidence that this will work. Firstly, upping hugely the number, 6,000 additional GP and specialist training places across the country, starting next year. So we increase the number of GP places from 600 to 900 per year. And then secondly, making sure that these are appropriately spread right across the country. But I finished where I began. It only works with you. Thank you for each of your dedication, enthusiasm, your brains. To get into medical school, you have to be really bright in the first place. So thank you that you actually want to do this work, because this country without a first-class medical system is not the country that we want for our future. So thanks one and all, and as I said, if all this program works well, it's all because of my leadership. Very positive.